Do you know what is schizophrenia? Schizophrenia is a long lasting psychotic disorder that involves a severe break with reality. People with schizophrenia are not able to distinguish between the real and fantasy due to the fact that the disturbance occurs in their thinking, emotion, behavior, and perception. According to the DSM-5, the symptom of schizophrenia can be categorized between positive and negative symptoms. Positive symptom is related to a core symptom of diagnosis such as hallucination, delusional, catatonic behavior, and disorganized speech. Meanwhile, negative symptoms appear to reflect a decrease in normal functioning such as anhedonia, which is lack of pleasure or interest in activities that once enjoyed, avolition, which is lack of motivation, and emotional disturbance such like affective deficit.
Okay, now the factor that may lead to schizophrenia is genetic factor. I'll talk about the genetic factor. Genetic factor variation in many genes contribute to the risk of developing schizophrenia. In most cases, multiple genetics may change genes, each with a small effect combined to increase the risk of developing the disorder. The ways that these genetic changes are related to schizophrenia are not well understood, and the genetics of the disease is an active area of research. The genetic changes can also interact with environmental factors that are associated with increased schizophrenia risk, such as exposure to infection before birth or severe stress during childhood.
Physiological mechanism for schizophrenia development.
According to the dopamine theory of schizophrenia, dopamine's function is to mediate motivational salience and thus offer a person the ability to decide which stimuli attracts their attention and drives subsequent behavior. Schizophrenia is correlated with the aberrant allocation of salience due to dysregulated delivery of striatal dopamine. Dysregulation of the dopamine system eventually contributes to the emergence of irrelevant stimuli that provide the basis for psychotic experiences, such as concepts of reference, where ordinary events can be layered with an intensified sense of bizarre meaning. This misappropriation of salience can lead to paranoid actions and persecutory delusion.
What type of treatment for schizophrenia?
Schizophrenia can be treated either by medications as prescribed by psychiatrists or psychological therapy by certified psychologists.
Why we need effective treatment for schizophrenia?
It is extremely important to treat schizophrenia as soon as possible after the onset. With delay in effective treatment, patients may be at increased risk for brain volume loss with adverse implications for long-term treatment outcomes.
How to encourage them to get help?
First, don't use a threatening or confrontational tone. Second, close and trusted family members or friends should lead the conversation. Last but not least, don't include people that they doesn't trust or feel close to, which can cause more anxiety, fear, or confusion.